The blood wouldn't stop coming. Frances Slanger pressed her hands against the soldier's abdomen and felt the warmth seeping between her fingers, felt the rhythm of his pulse weakening beneath her palms. She was 19 years old. She had never performed surgery before. The doctor who was supposed to be standing beside her was dead, killed by the same artillery shell that had brought down half the field hospital tent 40 minutes earlier. The generator powering the surgical lamps was running on its last reserves of fuel. The morphine was running out. The bandages were running out. The anesthetic was running out. And outside, in the mud and darkness of a Belgian forest in October 1944, there were 46 more soldiers waiting for her to decide whether they would live or die before sunrise. This is not a story about heroism in the way we usually understand it. This is a story about what happens when all your training, all your preparation, all your careful planning for how things should go suddenly becomes irrelevant because the world has caught fire, and you are the only person standing between chaos and death. This is about the moment when a young woman who had emigrated from Poland as a child, who had grown up in Boston dreaming of helping people, who had enlisted in the Army Nurse Corps believing she would comfort wounded men and assist real surgeons, suddenly found herself holding a scalpel over a dying soldier's chest with no one to tell her what to do next. Frances had arrived at the field hospital near the German border 6 weeks earlier as part of the 45th Field Hospital Unit, one of the first fully mobile surgical teams positioned directly behind the advancing American lines. The strategy was sound in theory. Get the surgeons as close to the fighting as possible. Reduce the time between injury and operation. Save lives that would have been lost in the long transport back to base hospitals in England or France. The field hospital consisted of tents that could be assembled in hours, surgical equipment that could be packed onto trucks, and medical staff who understood that they would be working in conditions that made conventional hospital protocols impossible. They had trained for this. They had prepared for the noise, the mud, the lack of supplies, the constant threat of enemy fire. What they had not prepared for was the possibility that the surgeons themselves might not survive long enough to perform the surgeries. The Germans had been retreating for months, but retreat does not mean defeat, and it certainly does not mean surrender. Every kilometer the Allies advanced into Belgium and toward the German border was purchased with blood and artillery fire, and the kind of grinding, exhausting combat that turned forests into graveyards. The field hospital was positioned 3 kilometers behind the front lines, close enough to receive wounded men within an hour of injury but supposedly far enough back to avoid direct combat. That calculation had proven wrong on the night of October 17th when a German artillery barrage, either incredibly accurate or incredibly lucky, had landed directly on the hospital compound. Frances had been in the supply tent when the first shell hit. She heard the whistle, that distinctive sound that soldiers learned to recognize and fear, the high-pitched scream of metal falling through darkness, then the explosion, then screaming. She ran toward the surgical tent because that was where the doctors were, where the patients were, where help would be needed. What she found instead was fire and smoke and a collapsed canvas roof pinning down 3 men who had been in the middle of surgery. One of the doctors, Captain Michael Doherty, was already dead, his body torn apart by shrapnel. The other doctor, Captain Robert Chin, was unconscious and bleeding from a head wound that would kill him before morning despite everything Frances and the other nurses tried to do. The 2 surgeons who had been handling the night shift, who had the experience and training to manage battlefield injuries, were gone in an instant, and the wounded kept arriving. The soldiers carrying stretchers into the hospital did not know that the doctors were dead. They did not know that the nurse taking charge of triage was a 19-year-old woman who had exactly 8 weeks of battlefield experience and whose surgical training consisted of assisting in procedures, handing instruments to surgeons, monitoring patients under anesthesia, and studying anatomy textbooks by flashlight in her tent at night. They knew only that their friends were dying and that this was the place where dying men were supposed to become living men again. So they kept bringing them in. Frances stood in the center of the surgical tent and looked at the scene around her. 4 operating tables, 2 of them still functional. Surgical instruments scattered across the ground from the blast. 3 other nurses, all of them looking at her with expressions that mixed fear and desperation and a terrible, silent question. One of the nurses, Lieutenant Sarah Morrison, was 34 years old and had more experience than Frances, but Sarah had assisted in perhaps a dozen surgeries and had never led one. The other 2 nurses were even younger than Frances, recent graduates from nursing school who had been in Europe for less than a month. They were all waiting for Frances to make a decision, to tell them what to do, because in the absence of doctors, the most senior nurse present becomes the person in charge, and Frances had seniority by exactly 3 weeks. She could have refused. She could have told the stretcher bearers to transport the wounded to the next hospital, 10 kilometers farther back, where real surgeons were still alive and capable of performing real surgery. That would have been the safe choice. That would have been the choice that followed regulations and protected her from accusations of practicing medicine without a license. That would also have been the choice that killed every single soldier waiting outside, because 10 kilometers in the back of a truck over roads cratered by artillery fire would take at least 40 minutes, and men with abdominal wounds and severed arteries and chest trauma do not have 40 minutes. Frances picked up a scalpel. The first soldier was 22 years old, a private from Ohio whose name Frances never learned because he was unconscious when they brought him in, and his dog tags had been lost somewhere in the mud. He had taken shrapnel across his stomach, and his intestines were visible through the wound, gray and glistening in the lamplight. Frances had seen surgeons repair abdominal wounds before. She had watched them clamp bleeders, remove damaged tissue, suture perforations in the intestinal wall. She had never done it herself. She had held retractors while surgeons worked, had sponged blood away from the surgical field, had counted instruments at the end of procedures to make sure nothing was left inside the patient. But she had never been the one making the incisions, deciding what to cut and what to save. She made the first cut and immediately realized she had gone too deep. Blood welled up faster than she could control it. Her hands shook. Sarah Morrison, standing beside her, said nothing, just handed her clamps and sponges and tried to maintain the pretense that this was a normal surgery with a normal surgeon. Frances forced herself to breathe slowly, forced herself to remember the anatomy lessons, forced herself to think through the steps. Find the source of the bleeding, clamp the vessel, tie it off, move to the next problem. The soldier's intestine had 3 perforations that needed to be closed. Frances had never sutured human intestine before, but she had practiced suturing on pig intestines during training, and the principle was the same. Keep the stitches small and close together. Don't pull too tight, or you'll tear the tissue. Make sure the edges are aligned so the wound can heal properly. It took her 45 minutes to complete the surgery. A trained surgeon could have done it in 20. But when she finally stepped back from the table, the soldier was still alive, his abdomen closed, his bleeding controlled. Sarah Morrison took over to monitor his recovery, and Frances moved immediately to the second table where another nurse had already prepped the next patient. This one was worse. A corporal from Pennsylvania with a sucking chest wound, meaning his lung had been punctured and air was leaking into his chest cavity with every breath, slowly collapsing his lung and crushing his heart. Frances had watched thoracic surgery exactly 3 times. She knew the theory. Make an incision between the ribs, insert a chest tube to drain the air and blood, repair the lung if possible, close the chest and hope the lung reinflates. She knew that thoracic surgery required precision and experience and steady hands, and she knew that she had none of those things in sufficient quantity. But the corporal was drowning in his own blood, and if she did nothing, he would be dead in 10 minutes. She made the incision. She found the puncture in his lung, a small tear that was leaking air and blood with every shallow breath the corporal managed to take. She repaired it with sutures, using tiny stitches that she prayed would hold when his lung reinflated. She inserted the chest tube, angling it carefully to avoid damaging the major vessels near the heart. She closed the incision and watched as the corporal's breathing gradually improved, his oxygen saturation slowly climbing on the monitor. 2 surgeries completed, 2 soldiers alive, 45 more waiting. Frances lost track of time. The night became a blur of blood and sutures and desperate improvisations. She performed an emergency amputation on a soldier whose leg had been so badly mangled by a mine that infection would kill him within days if the limb wasn't removed. She had never amputated anything before, but she followed the procedure she had seen surgeons use, cutting through muscle and tissue and finally bone, tying off blood vessels, leaving enough skin to fold over the stump and create a viable healing surface. The soldier screamed when the anesthetic wore off too soon, and they had no morphine left to give him, So he screamed through the entire final phase of the operation, while Frances worked with tears streaming down her face and her hands moving automatically through steps she barely understood. She removed a piece of shrapnel from another soldier's brain. She had never touched a human brain before. She made the incision in his skull with a saw that vibrated in her hands, cutting through bone with agonizing slowness because rushing would mean cutting too deep and killing him instantly. When she finally lifted the bone flap away and exposed the brain tissue beneath, she saw the shrapnel embedded in the frontal lobe, a jagged piece of metal surrounded by swollen, bleeding tissue. She removed it with forceps, moving with glacial slowness, praying she wasn't damaging anything vital. She closed the skull, replaced the bone flap, sutured the scalp. The soldier survived. She would never know if he woke up with his mind intact or if her clumsy surgery had stolen something irreplaceable from him. She repaired a torn artery in a soldier's neck, working so close to his carotid that one wrong move would have sent a jet of blood across the surgical tent and killed him in seconds. She reconstructed a shattered hand, pinning bones together with wire and hoping they would set properly without access to X-rays or proper orthopedic equipment. She removed bullets from chests and abdomens and limbs, sometimes guided by her knowledge of anatomy, sometimes guided by nothing but intuition and the desperate hope that she was making the right choices. The other nurses worked around her, following her instructions even though she barely knew what she was doing. Sarah Morrison handled the anesthesia, calculating doses of ether and chloroform by memory because their anesthesiologist had been killed in the initial blast. The two younger nurses managed supplies, sterilized instruments in boiling water when the autoclave stopped working, held retractors during surgery, and tried to keep track of which soldiers had been treated and which were still waiting. They all worked in near silence, speaking only when necessary, because words would have broken the fragile concentration that was keeping Frances functional. Around 3 a.m, a young lieutenant from the Transport Corps entered the surgical tent and stared at the scene with obvious confusion. He had expected to find doctors. He had expected to find experienced surgeons managing the wounded with calm efficiency. Instead, he found a teenage nurse covered in blood, performing what appeared to be abdominal surgery on a soldier while 3 other nurses assisted. He asked if the doctors were coming back soon. Frances did not look up from her work. She told him the doctors were dead. She told him that if he had wounded men outside, he could bring them in or he could transport them to another hospital. But if he chose to transport them, they would probably die on the way. The lieutenant stood there for a long moment, processing this information. Then he went back outside and started unloading more stretchers. By 4 a.m, Frances had stopped feeling her hands. They moved automatically now, following patterns burned into her muscle memory through hours of repetition. Pick up the scalpel. Make the incision. Control the bleeding. Identify the damage. Repair what can be repaired. Close the wound. Move to the next patient. She stopped thinking about whether she was doing things correctly. She stopped worrying about regulations or medical licenses or what would happen if she made a mistake. She simply worked, one soldier at a time, because stopping would mean letting them die. She did not save everyone. 3 soldiers died on the operating table despite everything she tried. 1 bled out faster than she could clamp the vessels. 1 went into cardiac arrest during surgery and did not respond to the crude attempts at resuscitation that were all Frances knew how to perform. 1 simply stopped breathing, his lungs too damaged by gas inhalation to sustain life even after she had repaired the physical wounds. Frances felt each death like a physical blow, but she could not afford to stop and grieve. There were more soldiers waiting, and grief was a luxury for later. Around 5:30 in the morning, just as the sky was beginning to lighten with the first hints of dawn, Frances completed her 47th surgery. The patient was a sergeant from Texas with a collapsed lung and internal bleeding that had required her to open his chest and directly massage his heart to keep it pumping while she repaired the damage. When his heartbeat finally stabilized and his breathing improved, when she could finally step back from the table and trust that he would survive without her hands physically keeping him alive, Frances realized that there were no more stretchers waiting. The wounded had all been treated. The night was over. She walked outside the surgical tent and saw the sun rising over the Belgian forest, golden light filtering through trees that had been shattered by artillery fire. Her hands were shaking uncontrollably now, the adrenaline that had sustained her through the night finally draining away. She sat down in the mud and tried to understand what had just happened. She was 19 years old. She had performed 47 surgeries in one night. She had saved 44 men who would have died without immediate surgical intervention. She had done things that no nurse had ever been trained to do, had made decisions that were supposed to be made by doctors with years of experience and advanced medical degrees. And she had no idea if she had done it right. The official military reports would later describe the incident in careful, bureaucratic language. They would note that in the absence of qualified surgeons, Nurse Frances Slanger had assumed surgical duties and had performed emergency procedures on multiple casualties. They would note that the survival rate among patients treated during that night was remarkably high given the circumstances. They would note that Nurse Slanger's actions had likely saved numerous lives. What the reports would not mention was the terror. They would not mention the moment when Frances had stood over that first soldier and realized that she was completely alone, that no one was coming to help her, that she would have to decide right then whether she was capable of cutting into another human being and trying to repair the damage. They would not mention the crying she had done later, after the adrenaline wore off, when she finally had time to think about what she had been forced to do. The Army would eventually award Frances Slanger a Bronze Star for her actions that night. She would be praised in military publications as an example of courage and initiative under fire. Other nurses would hear her story and feel inspired, reassured that even in the worst circumstances, it was possible to make a difference. But Frances herself would never speak about that night with pride or satisfaction. When other nurses asked her what it had been like to perform surgery alone, she would describe it as the most terrifying experience of her life. She would say that she had been certain, with every incision, that she was making a fatal mistake. She would say that she still had nightmares about the soldiers who had died on her operating table, wondering if a real surgeon could have saved them. 3 weeks after that night, Frances Slanger would be killed by German artillery fire while writing a letter to the editors of Stars and Stripes, the military newspaper. The letter would be published after her death, and it would become one of the most famous pieces of writing to emerge from World War II. In it, she wrote about the nurses working in field hospitals, about their dedication and their exhaustion and their determination to save every soldier who passed through their care. She wrote about the privilege of serving, about the satisfaction of knowing that their work mattered. She did not mention the night she had performed 47 surgeries. She did not mention the terror or the uncertainty, or the weight of decisions that no 19-year-old should have to make. She wrote instead about hope, about the belief that their work was contributing to something larger than themselves, something worth the sacrifice. But the night of October 17th remained, preserved in military records and in the memories of the 44 soldiers who survived because a teenage nurse had decided that the risk of trying was better than the certainty of doing nothing. Some of those soldiers would later try to find Frances, to thank her for saving their lives. They would discover that she had died 3 weeks after saving them. They would learn that she had been writing a letter when the artillery shell killed her, that she had been trying to tell the world about the nurses who worked in impossible conditions and saved lives anyway. The deeper story, though, is not about heroism or sacrifice or even about Frances Slanger specifically. It is about what happens when systems fail and individuals are forced to improvise solutions to problems they were never prepared to solve. The military medical system in World War II was sophisticated by historical standards. It had protocols for evacuation, procedures for triage, chains of command that were supposed to ensure that the right people with the right training were in the right places at the right times. But protocols only work when circumstances allow them to work. When German artillery destroys your field hospital and kills your surgeons, the protocols become irrelevant. When wounded men are dying faster than you can transport them to the next hospital, the regulations about who is qualified to perform surgery become irrelevant. In those moments, the system breaks down, and what remains is a single person standing in a blood-soaked tent making impossible choices. Frances Slanger made the choice to try. That decision, more than any particular surgical technique or medical knowledge, was what saved 44 lives that night. She could have followed regulations. She could have prioritized her own safety and career over the lives of soldiers she had never met. She could have made any number of reasonable, defensible decisions that would have resulted in those men dying. Instead, she picked up a scalpel and started cutting, trusting that her limited knowledge and her shaking hands would somehow be enough. And for 44 soldiers it was. The aftermath of that night rippled outward in ways that Frances never lived to see. The Army Nurse Corps used her story as evidence that nurses needed more advanced training, that the line between nursing and surgery was not as clear in battlefield conditions as it was in civilian hospitals. Medical schools began incorporating more emergency surgical training into their curricula, recognizing that future wars would create situations where non-surgeons would be forced to perform surgical procedures. The field hospital system was redesigned to ensure redundancy, so that the loss of one or two surgeons would not leave an entire facility without surgical capability. But beyond the institutional changes, there was a more personal legacy. The soldiers who survived that night told their families about the nurse who had saved them. Those families told their children and grandchildren. The story spread, acquiring mythic qualities as it passed through generations, becoming less about the specific details and more about the idea that ordinary people can perform extraordinary acts when circumstances demand it. Some versions of the story exaggerated Frances's age, making her even younger than 19. Some versions exaggerated the number of surgeries, inflating 47 to 100 or more. Some versions turned her into a legend, a superhuman figure who felt no fear and made no mistakes. The truth was more complicated and more valuable. Frances Slanger was terrified. She made mistakes. She lost patience. She cried. She doubted herself constantly. And despite all of that, she kept working, kept trying, kept making decisions and performing surgeries and doing her best to save lives. The heroism was not in the absence of fear but in the decision to act despite the fear. The achievement was not in performing perfect surgeries but in performing adequate surgeries under conditions where even adequate was almost impossible. When historians examine World War II, they tend to focus on the large-scale strategic decisions, the battles that shifted the momentum of the war, the technological innovations that changed how wars are fought. The night Frances Slanger performed 47 surgeries does not appear in most histories of the war. It was too small, too localized, too personal to register against the massive scope of global conflict. But for 44 soldiers and their families, that night was everything. It was the moment when their war ended not in death but in survival, when a 19-year-old nurse became the thin line between existence and oblivion. In the decades after the war, medical professionals would study what Frances had done that night, trying to understand how someone with so little training had achieved such remarkable results. Some attributed it to luck. Some attributed it to natural talent. Some suggested that her very lack of formal surgical training had been an advantage, allowing her to improvise and adapt without being constrained by conventional surgical orthodoxy. The truth was probably simpler. She had paid attention during the surgeries she had assisted with. She had studied her anatomy textbooks obsessively. She had asked questions and learned from experienced surgeons whenever possible. And when the moment came, she remembered what she had learned and applied it as best she could. But knowledge alone would not have been sufficient. What made the difference was her willingness to take responsibility, to accept the terrible burden of making life and death decisions without the authority or experience that would normally accompany such responsibility. That willingness is rare. Most people, faced with a situation so far beyond their training and capabilities, would freeze or defer to someone else or find reasons why attempting surgery would be worse than doing nothing. Frances could have done any of those things, and no one would have blamed her. The doctors were dead. The wounded were dying. She was just a nurse, too young and too inexperienced to be expected to handle such an impossible situation. She did it anyway. That choice, made in a moment of crisis in a Belgian forest in October 1944, reveals something fundamental about human capability and moral courage. We are not limited by our official qualifications or our formal training or our age or our experience. We are limited by our willingness to act when action is required, to try when trying seems hopeless, to accept responsibility when responsibility is thrust upon us. Frances Slanger was 19 years old, but she was not too young to save lives. She was not too inexperienced to make decisions. She was not too frightened to pick up a scalpel and start cutting. The soldiers she saved that night went home to their families. They had children and grandchildren. They built careers and lived ordinary lives that would have been impossible if Frances had chosen differently. Some of them knew they had been saved by a nurse rather than a doctor. Some of them never knew the truth about that night, never realized how close they had come to dying not from their wounds but from the simple absence of qualified surgeons. But whether they knew or not, Their survival was a testament to the possibility that circumstances do not have to determine outcomes, that limitations do not have to be final, that sometimes the person who saves your life is not the person you expected. Frances Slanger died 3 weeks after proving what she was capable of. She was killed not because she took unnecessary risks or because she failed to protect herself, but because war is chaotic and arbitrary and deadly, and even the most capable people can be killed by random artillery fire in the middle of writing a letter. Her death was meaningless in the strategic sense, accomplishing nothing, changing nothing about the outcome of the war. But her life, and specifically that one night when she performed 47 surgeries, had created meaning that would ripple forward through time, influencing how we think about capability and courage and the extraordinary things ordinary people can achieve when necessity demands it. The story of Frances Slanger is ultimately a story about that gap between what we think we can do and what we can actually do when we have no choice but to try. Most of us go through life never discovering the limits of our capability because we never face situations extreme enough to force us beyond our comfortable boundaries. We specialize. We defer to experts. We stay within our lanes and our qualifications and our official roles. And that is usually the right approach. But when systems fail, when experts are unavailable, when the comfortable boundaries suddenly evaporate, we discover that we are capable of more than we imagined. Not always, not everyone, but often enough that Frances Slanger's story represents a possibility rather than an exception. She was 19 years old, too young to drink legally in 1944 America, but old enough to hold a scalpel over a dying soldier's chest and make the decision to cut. She was a nurse, trained to assist rather than lead, to follow doctors' orders rather than make independent surgical decisions. She was a young woman in a military system that did not fully trust women to handle combat-adjacent roles. She was an immigrant, a Polish Jew who had come to America as a child and had grown up with limited resources and limited opportunities. By every conventional measure, she was not the person who should have been performing emergency battlefield surgery on 47 soldiers in one night. But she was the person who was there when it mattered, and so she became the person who did what needed to be done, not because she was particularly special or uniquely talented or chosen by destiny, but because she chose to act. That choice, repeated 47 times over the course of one endless night, saved lives that would have been lost if she had chosen differently. It did not make her immortal or invulnerable or immune to the randomness of war. It did not prevent her death 3 weeks later. But it did mean that 44 soldiers survived to go home, to have families, to live lives that would not have existed without her decision to try. When the sun rose over that Belgian forest on the morning of October 18, 1944, Frances Slanger was no longer a 19-year-old nurse who had never performed surgery. She was someone who had discovered the outer limits of her capability, who had been tested in ways that would break most people, and who had somehow found the strength to keep going even when every surgery felt like it might be the one where she finally failed. She had learned that she was capable of far more than she had believed possible, and she had learned that capability alone is not enough, that knowledge and skill and training are valuable but ultimately secondary to the willingness to accept responsibility when no one else can. That lesson, written in blood and exhaustion across a single night in October 1944, is the real legacy of Frances Slanger. Not the specific surgeries she performed or the specific techniques she improvised, but the proof that ordinary people thrust into extraordinary circumstances can rise to meet those circumstances if they choose to try. Not always successfully, not always perfectly, but often enough that her story stands as evidence that our limitations are not as fixed as we imagine, that the boundaries we accept as defining what we can and cannot do are often more flexible than we realize. That sometimes the most important qualification for doing the impossible is simply the willingness to attempt it when no one else can. Frances Slanger was 19 years old on the night she performed 47 surgeries. She was too young to drink, too inexperienced to perform surgery, too frightened to believe she would succeed. She did it anyway. And for 44 soldiers, that choice made all the difference between death in a Belgian forest and survival to see another day. That is the story. Not a story about superhuman ability or flawless execution or destined heroism, but a story about a young woman who faced an impossible situation and decided that trying, even with shaking hands and inadequate knowledge and overwhelming fear, was better than accepting the alternative. She was wrong about many things that night, She made mistakes. She lost patience. But she was right about the one thing that mattered most. She was right that she had to try. And that decision, more than any other single factor, is what transformed a 19-year-old nurse into someone who saved 47 lives in one night, and proved that age and experience and official qualifications matter far less than the courage to act when action is required.